Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then, incidence of breast cancer. In the incidence of breast cancer, sporadic breast cancer is seen. Sporadic breast cancer is seen in around 65 to 75%. It is sporadic breast cancer, whereas familial breast cancer. Familial breast cancer will account for around 20 to 30%. Then we have hereditary breast cancer. This hereditary breast cancer will account for about 5 to 10%. Among this 5 to 10%, BRCA1 is responsible for 45%, whereas BRCA2 is responsible for 35%. Then P53, that is Lee-Fraumeni syndrome. This P53 Lee-Fraumeni syndrome is responsible for 1%, STK11 LKB1A, which is by Peutz-Jeghers syndrome. This Peutz-Jeghers syndrome, so this is responsible for around less than 1%. Then we have P10 mutation, P10A mutation, which is by Cowden's disease. Okay, this is responsible for less than 1% again. And then we have MSH2 or MLH1A, which is actually Moore-Torrey syndrome, and this is responsible for less than 1% of breast carcinoma. Then ATMA gene mutation, which is seen in ataxia telangiectasia, and this ataxia telangiectasia is responsible for less than 1%. And there are two unknown genes. Unknown genes are responsible for almost 20%. So this is the incidence of breast cancer.
thank you and thank you for watching.